cities in the north are braced for a strict lockdown under the new three-tier system of restrictions, which could see pubs, bars, bookies, casinos and gyms ordered to close again.
Well, Tier 1 includes the current restrictions of 10 p.m. curfew and the rule of 6. Tier 2 adds on a ban on indoor mixing of households. And Tier 3 forces hospitality and shops to shut.
The northern regions have had some of the highest infection rates. But will a tough lockdown prove too damaging to the local economy and its people? Joining us to discuss this, Lord David Blunkett, who says treating the north like a lab is a blatant misuse of power. Manchester's nighttime economy advisor, Sacha Lord, who says the north-south divide is wider than before. But let's talk first to the Metro Mayor of the Liverpool City region, Steve Rotherham, who joins us now, along with Professor Devi Sridhar, concerned the message and restrictions need to be simpler so we can all abide by them. Steve Rotherham, Liverpool has almost 600 infections per 100,000, where the average for England is 74 per 100,000 people. What has gone wrong in Liverpool?
Well, we'd like to know, because we've asked the government to help us with the scientific evidence so that we can really interrogate that and find out what has happened actually in the Liverpool City region. It's a very disparate picture. In Liverpool, of course, there's a large student population, so we can sort of understand why they've seen a spike in certain parts. But in Knowsley, just down the road, and they've got an equivalent number of people who have tested positive without a student population. So we're asking for the government to help us to better understand what the data sets actually show us.
Is it not reasonable that with that number of infections in one city area, that something is done? You close down the places where you're likely to be in contact with people in close proximity. Alcohol disinhibits people, stops social distancing, but also, you know, gyms, places where there might be lots of other people transmitting the virus. It's obviously going to be very restrictive, but what else should be done?
Well, we've been speaking to the government, Susanna, since Friday evening, and the one thing that we are in full agreement on is that we both share the concerns about the pressures on our hospitals, and we both understand that we need to do something to bear down on the exponential increase we've seen in transmission rates. But it's how you do that, isn't it? And it's what package of support national government provides that enables local councils to do more, and that's the detail of what we're still negotiating now.
Lord Blunkett, it seems to me the big problem here is that if you don't have an effective, workable test, trace, isolate system in place, what choice do you have but to go for local lockdowns or even a national lockdown if it comes to it, to try and suppress what remains a very dangerous virus? If you were a still Home Secretary of this country, would you not be basically thinking, well, we don't have the right test and trace isolate system, it's not working, infections are out of control, hospitalisations are doubling week on week. What else can you do?
Well, I think the operative words are if you don't have, and obviously getting that to work locally, and they've been using this world-class app that went pear-shaped, and then the new app, I think 4 million people have signed up to it, but what you need is a concentrated approach. So instead of COVID marshals actually having a go at people, we need health education champions. We need them out there in the neighbourhood, in the community. We need to ensure that people are following basic, sensible rules. We need the 60,000 people who were recruited back into the health service, former health service workers, actually deployed sensibly where they're needed most. We need to open the Nightingale centres and prepare to open other ones so that we don't displace those who are waiting for essential surgery, so that they don't die because they've been displaced by people being taken into hospital. And above all, we need a bit of common sense in terms of, firstly, where the evidence is, and secondly, how you count the figures.
Right, but
for instance, in Nottingham,
I think I agree
which
with
is
you.
a city half the size of... Wait, no, hang on a minute. I'm just going to finish this sentence.
Yeah.
Piers.
Okay.
Thank you very much. Nottingham, half the size of Sheffield, two major universities, 3/4 of the 2,600 who over the weekend were identified as having the virus actually were students. Take those out of the statistics and then concentrate your attention where it's needed most.
Yeah, but the problem is that I'm actually not looking at the infection rates. I'm looking at the hospitalisation rates in the northwest, and they are scary numbers. We're now at the same level of hospitalisations we were back just before the lockdown on March the 23rd. So again, I ask you, everything you're saying will take too long to put in place to actually deal with this right now present problem. So what do we do?
Well, you have a combination. I'm not against taking urgent and decisive action, although it will mean that you actually provide the support and compensation now and not from the 1st of November in order to keep the local economy going. I don't happen to frequent pubs all that often, so I've not got a great love for the pub industry, but I have for the survival of those jobs and the people who are running them. And therefore, it's a combination of tough and necessary measures on the one hand, confidence, consistency and clarity on the other. And unfortunately, we haven't had any of it.
Well, Lord Blunkett, can I just ask, in the column that you wrote in the Daily Mail about this, you said treating the North like a lab is a blatant misuse of power. It's a dictatorship. The measures being debated are so extraordinary they're almost comical. Appalling damage is being done to our liberties in the name of preserving our health. Now, the current Labour leader, Keir Starmer, has broadly supported the measures by the government. Do you think that the Labour Party in opposition should be much stronger in criticising, analysing, investigating these measures?
And opposing. And opposing them, directly opposing them, over 10 p.m. and so on.
They've been deliberately careful not to be accused of being on the wrong side of the argument. I mean, in politics, you know, Piers, I've known you a long time. You know that people sometimes set up Aunt Sally's in order to place their opposition in an impossible situation. I think Keir's been very clever in avoiding that so far, but he has started to make it absolutely clear that the mess we have over test and trace, the mess we have over lack of clarity and consistency, including announcements last Friday that are going to be overturned this afternoon because they'll have to introduce new economic support measures that go much, much further than they announced on Friday. That kind of inconsistency has to be exposed, and so does what's happened to the north of England over the last 10 years, because as everyone understands, the levels of deprivation because of the austerity measures have added to the challenges that we now have in the northwest.
OK, I mean, look, my issue with what Keir Starmer's doing is that if, as seems the case, everyone on the Labour front benches thinks the 10 p.m. curfew is completely wrong, it's not good enough to say the Cabinet's a disaster, Boris Johnson's hopeless, Matt Hancock should resign, blah, 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 but we're going to support everything the government does. That, to me, is not about being an effective opposition. Well, damn the politics. This is about people's lives.
Well, of course it's about people's lives, and at the bottom of everything, that's what we've got to be concerned about, the lives of those who are displaced from the health service as well as those affected by COVID. My line on the 10 o'clock, for what it's worth, would have been that if there'd been a phased curfew, so that those who don't have food, don't have sit-down restaurants, were shut down earlier, we wouldn't have had the scenes on the street where people are mingling and drinking outside the venues. Because in the end, what you want is people to be in places where you can monitor whether they are.
But instead, we're sending them all to off licences and
very basic rules.
Well, we're sending them all to off licences and private homes. Professors, I want to bring in Professor Sridhar, if I may. In China, in a place called Qingdao, 9 million residents live in Qingdao. They had 9 new cases of coronavirus confirmed in the sort of legendary beer part of the city, all linked to a hospital. So there is now mass testing over the next 5 days of all 9 million residents.
How can they do that?
How is it that, I mean, and China, we know, has had very few deaths from COVID-19, despite it starting there. Why are so many places in the East, the Far East, so much more sophisticated and up to speed on testing when we are such a disaster here after 9 months of a pandemic?
Yeah, I think if you look at East Asian countries as well as the Pacific countries, Australia, New Zealand, they have played, the SARS playbook, which is this is a dangerous virus. We cannot let it spread, and we need to have any kind of fires put out very quickly. And their populations understand that. Hong Kong, Singapore, South Korea, they get this is a dangerous virus. All parts of their population. I feel like the UK, we've been stuck in: is this a serious virus? Is it harmless to young people? Is it like the flu, the economy, or health? And in a way, getting muddled up. Or actually, they just went hard, they went early, they try to clear the virus, and they know that it's better to lock down those 9 people and clear that virus within a week or 2 than to let it spread to 1.3 billion people and be in the kind of situation that's happening in other parts of the world.
Sacha Lord, you are the nighttime economy advisor to Andy Burnham, who's the mayor of Greater Manchester, and you have launched legal action against the government because of the impact of all of this on hospitality. We've already mentioned that in cities where there is a big student population, that is probably one of the reasons that there are such high infection rates. But do you think that pubs, bars, restaurants are paying the price because the government has committed to keeping schools and universities open?
No, good morning. So we've been calling on the government for weeks and weeks to say, look, give us the scientific evidence why you want to put these restrictions in place. Because only last week, the figures from Public Health England showed that anybody that contracted COVID last week, only 3% were associated to the nighttime economy. And, we don't feel it's good enough. Andy Burnham this weekend said that we feel like we are being treated like second-class citizens. When the UK went down into national lockdown, it was 80% furlough. But now, if you live in the north and work in hospitality, you'll see 67%. I mean, it doesn't make sense. It's not fair. And for us and for many, many other operators, it feels reckless and like we're throwing it under the bus. And let me just add to this. Clearly, every single person that works in hospitality realises that safety has to come first. It really does. And for many places, they were shut down for 20 weeks. No income coming through the tills whatsoever. They put so many implementations in place now that, it is far safer, in our opinion, to go to a pub where you're seated, you're met at the door, you're given your details, you wear your mask, you walk to the table, you sit down, there's table service, you order from a QR code, you have your drink, you pay by credit card and leave through the one-way system. If you shut those pubs down, people will just go to house parties. And Piers, you retweeted me a few weeks ago when I was showing the people partying in the streets. I mean, whoever's making these knee-jerk decisions in the government are not dealing with operators because, we saw what happened with the curfew. And by leaking that news that came out on Wednesday, what do you think happened in the city centres across the UK this weekend?
Yeah. Of course.
On Saturday night, it was like New Year's Eve.
Yeah,
last orders,
and I wonder, and again, how many it'll be like back in March when they all went to the Cheltenham Festival. Final word to Professor Sridhar. If we don't take dramatic action right now, what is going to happen in this country in a month's time?
Well, you only have to look at the hospitalizations and the way the virus is spreading. We hopefully won't see those numbers we saw back in March because people are being more cautious. There are, large sections of the population who remember vividly, the clapping on Thursdays for health workers, the deaths that accrued, weighing up to over 1,000 a day. This is what will happen, according to the modeling, if we don't get a handle on this now. And this is not about choosing COVID or other health issues, because the problem is if the hospitals are full of COVID patients, that means other patients cannot be seen or will struggle to be seen, or you have difficult triage decisions. So it's really quite a dire situation we're in. And hopefully, even if they have to take strong action now, we learn something this time. So it's different going into the future.
I would like to think that'll be the case, but I have a sense of foreboding, I'm afraid.